This is Chapter 9, Part 2, and now we're moving to Piaget, who's our cognitive development theorist. So he calls from birth to 24 months sensory motor, because everything they're using their senses and their motor, their movement, in order to experience it. During the first 12 months, though, of that stage, they start with just reflexes, right? You put your finger in their hand and they squeeze it. It's a reflex, or the rooting reflex if you touch their cheek. And then they go to repetitive acts where, they're kicking or they're grabbing or they're looking at their fingers, and then imitative activity. And this is where you'll get an infant who will really watch you and try and do exactly what you're doing with their hand or their mouth or whatever it is. So Piaget says the really important things that they've got to learn during this first 12 months is first that they are separate from other people. When an infant cries, it gets fed. It takes it a little while to realize no one has to come and feed it. And just because they want to be fed right now, the person who's bringing the bottle or the breast to them can wait. They don't have total control of that person. That person is separate from them. So that's the first important cognitive skill. And then the next one is object permanence. And this is where if it's out of sight, it still exists. An infant, younger infant, they drop a toy, they look around for a different toy. They don't realize the toy that they don't see is still there. They just see what's in front of their face. And so they've developed this when they start searching for things. Or that game where they're dropping things repeatedly and having you pick them up and give it back. That's not just an annoying game. They're learning object permanence, that it falls down and I can't see it anymore, but it comes back because it's still there. So once they've developed that object permanence, now they can start to do mental representation. So they can imagine the mother or the caregiver or the toy or the bottle or the whatever thing they want without actually seeing it. They can think of it and picture it in their mind because they know it exists even if they're not seeing it. And so that's that mental representation. So moving on to development of body image, our book says this very closely parallels their cognitive development because they have to have that object permanence. And by the end of the first year, they have to have developed that idea that they're separate from their parents and what they want may not be what their parent is going to do. And during this stage, they love looking at mirrors, pictures of kids in general, but they really do like to look at mirrors, and they understand that's themselves. So they also, those babies, right, they discover their fingers, they discover their toes, and they have a lot of fun playing with those for a few days when that's a whole new discovery, that there are parts of their body that they can look at it and make it do things at the same time. So here's a baby developing object permanence. If you hid that under the pillow, she was going to try and find it. And here's a baby enjoying a mirror. They do very much enjoy mirrors and looking at themselves. So social development. It's important for babies to get that consistent care. There's been any number of studies of infants in orphanages or places where their physical needs were met, but they weren't touched and held and loved, and they develop lifelong attachment issues. Reactive attachment disorder being one possibility of those. Around 6 months of age, babies develop separation anxiety. They don't want to be separated from the parent. And about the same time, they're developing stranger anxiety. They are learning who are their people and who are not their people. And they don't want you because you are not their people. They want the people who are their family, their people. Play is a major part of how children develop. It's a major socializing agent. So they learn skills, they learn those manual motor kinds of skills as well as social skills, as well as just stress relief when you're dealing with hospitalization. Anyway, play is the work of the child. So here's infant developing attachment with family. Language. So initially babies cry. And if you talk to a parent after the first few weeks of life, they'll tell you there's different cries. There's the hungry cry, there's the mad cry, there's the bored cry. And then they start doing vocalizations. They start with vowel sounds, oohs, ahs, and then move towards adding some consonant sounds. Around 3 to 4 months, they should be able to really coo, gurgle, laugh, and they get really fun. Usually by 3 months, parents say they're just so much fun. They start really having personality and being interactive. Imitating sounds with consonants by 8 months. So they sound like they're doing speech. They have the cadence, the intonation, but there aren't necessarily words. But that's at abba dabba doo doo gaga doo da. There's not a word in there, but they have the cadence and the intonations right. And sometimes they'll repeat it exactly because you didn't understand it, and they'll repeat exactly what they said. By 9 to 10 months, they know what no is, and they can follow a simple command. Not a 2-part command, but, give me that or take this. So simple commands. By 10 to 11 months, they have understand some words have meaning, so they probably know mommy and a sibling's name and things like that. They hear that word and they turn and look at that person. They know what that word means. By a year, we want to see at least 3 to 5 words that they are saying with meaning. It doesn't mean anyone outside of the family can understand it, but they always say the same thing to mean this item, their blanket, their bottle, family members. So some concerns, temperament. Some kids are easy and some are hard, and especially when you have kids who are maybe those just difficult children and very compliant parents, when you have a mismatch, it can cause a lot of concern. Separation and fear of strangers, that stranger anxiety, separation anxiety. Reassure parents that it's normal. Child care, dropping the kid off and they scream and fight. Kids rarely scream all day long. They scream when the parent leaves and then they start playing. And as soon as they see the parent coming back, they start screaming again, and the parent thinks they've been screaming all day, but they really haven't. Limit setting and discipline. Very important for all children to have limits. Discipline and limit setting, these should be realistic for the child's maturity and the child's age. The recommendation with timeouts is that you do a minute per age. So, a 3-year-old is only getting 3 minutes of timeout, not 20 minutes. Thumb sucking and pacifier use. Our book is not very pro on these, although there isn't a lot of studies that show a problem with them either. And then teething. Teething's a big issue. Teething is kind of the cruel thing of the first year of life. It is painful. Kids don't sleep well. They're irritable. So giving some Tylenol. They have numbing agents that you can rub straight on there, or frozen teething rings to chew on is very soothing. Promoting optimal health, we really would like moms to breastfeed or give breast milk. A lot of people are not comfortable with breastfeeding but will pump and give breast milk, and that is the ideal food for a baby for 6 months of life. They do not need anything else, and they especially don't need extra fluid, no water during the first 4 months, and no honey during the first year. That's because of a concern of botulism. So breastfed babies, we will wait until they're 6 months to start giving them solid foods. When you do start introducing solid foods, you want to go one food at a time and wait at least 4 days, 4 to 7 days between introducing foods. Because if you introduce 3 new foods and they have an allergy, you don't know which one the allergy was to. So by waiting several days, it gives you that chance of being sure that they don't have an allergy, or you know what it's to. Fluoride supplements, the teeth are forming long before they come out, and the permanent teeth are forming behind those baby teeth. So fluoride strengthens those teeth as the enamel is being formed. Waiting till those teeth have come out is really kind of too late. The other recommendation in our area is vitamin D, that we usually give that as a supplement, even with breastfed babies. So finger foods, they can do that fine pincer grasp and hold finger foods by 9 months. After a year, they should be weaned from breast or bottle to cup. You can do those sippy cups. Sleep. By a year, most babies are sleeping at least 8 hours a night plus 2 daytime naps. And how long they sleep at night kind of just depends how long their naps are. Back to sleep. We want babies to sleep on their back. It's made a huge difference in SIDS. Sleep problems, try and have a nice way of winding down before bedtime. So it kind of triggers the child that bedtime's coming, and it also is relaxing. Sleeping arrangements, some people and some cultures have babies sleep in the parent's bed. In American culture, we tend to have kids sleep in their own bed. That's really fairly individual choice. Infant walkers, those were really popular for a long time, and a whole lot of injuries happened with them. And we really tried to get parents to quit using them, but parents like the idea. They think the kids learn to walk earlier, but there is no study that shows that that's true. And they are fairly dangerous. Kids fall down stairs with them. They can move. They can get to things that they shouldn't be able to get to. And then dental health, the book recommends that as soon as you start having teeth, that you start seeing a dentist. The teeth should be cleaned, preferably just using water initially. Kids don't usually like the taste of toothpaste, and you don't want that to become a really negative thing. And then know if there's fluoride in the water where you're at, or do you need to do fluoride supplements. Injury prevention. Think about small toys, especially if there's an older sibling. Suffocation, things that come in bags. Get those bags out of the way. Motor vehicle accidents are our leading cause of death. Falls, poisonings. Can they start being mobile? Can they get to where poisons are? Burns, pulling hot things over on them, drowning, even a bucket of water or a toilet, anything that they can get into is dangerous.